The labor started late in the night, around 1 a.m. I endured the pain till 5 a.m. in the morning because of the journey we had to travel for so long. And my wish for every woman is that this should not happen again.
If there was ever a time when every second matters, it's when it comes to access to emergency obstetric care. Complications of pregnancy and childbirth can occur anywhere. Pregnancy itself is a high-risk condition. A problem in Nigeria is the access to services in both urban and rural settings. Pregnant women have to wade through traffic to get to care. They have to wade through poor road infrastructure to get to care. Buses trying to mass commute people across the city. A woman could live close to a facility, but yet be still too far away from care. And sadly, this increases the risk of her dying or her losing her baby.
Google has been working with the OnTIME Consortium to build a dashboard. We estimate travel times from Google Maps, and it's our insights, plus the expertise and on-the-ground investigations conducted by OnTIME that deliver the recommendations for policymakers. The same machine learning technology from Google Maps that helps you figure out how long it's going to take you to get to the shops, how long it's going to take to get to school, can also be used to power a tool that shows what insights would be relevant for decision makers so that pregnant women can reach emergency obstetric care faster.
What the dashboard does, it allows us to identify areas where women are having to travel more than 30 minutes to care. Those are hotspots. The onus is then on us to then try to understand why is that place a hotspot and take that information as a package to policymakers. It might be that there are limited functional public emergency obstetric care facilities, so there's some need to upgrade or build new ones within that space. It might be about the road infrastructure, needing to repair roads in the area. If we can get a pregnant woman to hospital, we can reduce the chance of maternal death by as much as 50% and reduce the chance of a stillbirth by as much as 75%.
As a ministry, we'll be able to use OnTIME insight recommendations to see how best we can make improvements in our systems, how we allocate resources in terms of fixing of roads, and also making transport available, irrespective of where you live in the city.
This is an example of a responsible use of AI that has the potential to lead to immense positive health outcomes. This technology can be applicable in many other domains. Figuring out access to vaccination sites, access to blood donation centers. There are countless examples of insights like this that would be helpful for public service planners, and this is just the beginning.
I was really worried about my baby because we had to travel for so long. My hope is the government should support the women to make things easy for us to get to the hospital on time.